Well, thank you for joining us. We are at the Juniper Clinic, part of Inova. We'll head on in the front door here. This is our beautiful reception area, but we will go ahead and head on back into the clinic area. Our nurses are located here along the way, so we have their offices here to the side. So we're really close to working with everybody else. All right, so in here we have, this is my office space, so you can see I have lots of my resources here, my patient education handouts, my glucometers for patients, things like that. So then when we get down this way, we are in the main hallway where all of our providers are located at. So here on the left, we have where one of our main providers sits. We have her office, and then some of the nurses and nurse case managers will sit in the back as well. So it's very much a team environment, and you can see everyone is working very closely together. Going down the hall, we have some exam rooms. So you can see what some of the exam rooms look like in here. This is just one of 7 clinics. So this one is our Juniper Prosperity location. We also have 6 other locations all throughout Northern Virginia, but they're all relatively similar. This one here on Prosperity Avenue is our largest clinic though, so we have about 600 patients. And we have some other staff offices here, so some of our nurses and other providers will work in this space. And then coming on down this way, we have a couple of counseling rooms. So we have a psychiatry service as well. So they'll use some of these kind of larger rooms in case we have groups of people or children or anything like that, and they can work in this space as well. And then we have our nurses station, so they can get all of our patients seen quickly. And then we just sort of loop back around to where we started. And you can see we also have some of our offices. We have a large education team. They work back here as well.
Hi, my name is Joan as practitioner at Inova Juniper programs. I've been working here for 2 years, so mainly we're taking care of HIV patients, and also we do primary care as well, which means we're taking care of patients who have HIV. They also have a comorbidity like diabetes, high blood pressures, and just everything we do here, as also including like women's health as well, pap smear. And also we will do pediatricians as well when if they have a perinatal HIV infection, so we're taking care of the kids until they are 6 months. And also we have luxury here to have a pharmacist, Kayleen, join us last year. So it is such a blessing to have her here, since we have a patient who have lots of problems like mentally, and also they have smoking problems, and also have uncontrolled diabetes and high blood pressures. And she's here to assist us, with patients' diabetes teachings, high blood pressure management, and also smoking cessations as well. So she has been really doing a lot for us, to work with us, and also she has been independent to working with the patients as well, to teach the patients, including weight management as well. So for some situations, I refer my patient to Kayleen, the pharmacist, because so for example, I have a patient like uncontrolled diabetes, or maybe a patient on very complicated regimens for diabetes, or maybe high blood pressures, or maybe patient does not have knowledge about diabetes as well. Like especially we do have a newly diagnosis with diabetes. So Kayleen also helped me teaching the patient with the glucometer teachings and diabetes management. Also have a patient like need to have smoking cessations teachings and medication, select the right medication for patient for smoking cessation. So for this type of patients, I do refer my patients to Kayleen.
My name is Kayleen Skim. I'm one of the nurse case managers here at Inova Juniper, and I help connect patients to access to care and making sure that they're able to get their medications. So it's been really nice to have a pharmacist on staff, just because if I have a patient with a complicated medication regimen, I have someone to refer to, just to make sure that there are no drug-drug interactions, to make sure that everything is safe for the patient, and also just if I have a question about a medication and need clarification. So I'm part of the Rainbow crew here at Inova Juniper. We focus kind of on, bringing up the spirit in the clinic and making sure that everyone is recognized for the things that they do and enjoy their time. So we'll come up with fun spirit days. Typically, it would be on the Fridays. You would dress up in certain themes, whether it's your, school spirit or your favorite sports team. But we just kind of try and bring a good vibe to the clinic.
Hello, my name is Maisha. I am the pharmacy liaison here at the Inova Juniper program. A lot of the nurses, even the eligibility team providers, I work with them day to day. They pretty much ask me to run test claims to find out if a patient is eligible to fill with Inova. They may ask me what a patient's copay is, if I can obtain financial assistance for patients. Sometimes I have to find patients' insurance information, help them out with that. If there's a refill needed, I often speak to a nurse or a nurse case manager. We do have patients here who are followed directly by a nurse case manager, meaning that the nurse case manager will actually do their pill boxes. So they fill their prescriptions here, and the nurse case manager, she fills up the prescription box. And so I follow those patients as well. A lot of them fill with the Inova specialty pharmacy. So not only am I dealing with the actual HIV or specialty medications, but I deal with some of their ancillary meds as well.
Hi, I'm Whitney Zancraft. Welcome to Inova Transitional Services Clinic. It's exciting that you're here virtually. We're in our patient waiting room and we're going to take a tour. So here we have 6 exam rooms. It's very exciting. They all look the same. You can see we've got, our stethoscope, our blood pressure machine, our documentation stations, all of that. There are several different other healthcare providers that work here. This is the nurses station where I can always find a nurse here to help either answer questions about prescription assistance programs or applications that we have going on. The nurses also really help with making sure that we get our vitals in. Our nurses complete the vitals, the blood pressure, temperature, weight, all before the patient comes into the clinic, or into the exam room, I should say. Our next cubby is empty today, but typically it's very filled with our providers. We have physicians, nurses, or nurse practitioners who are here providing care. And we also have medical residents. We have pharmacy learners, we have medical learners. It can get very busy here with all of the different providers. Here we also have another nurses station where we have people who might be calling patients, making sure that their care is connected. Really important, this is something that we use every day as our wall of resources, whether it's making sure that the person is referred to the appropriate follow-up care or clinic, or they're getting their log to make sure that they're writing down their blood pressures and their blood sugars. The thing about Inova Transitional Services Clinic is that we see a lot of patients who are underserved or uninsured. We have people who are leaving the hospital and coming to us because they don't have a primary care, they're not established anywhere. So our job here is to see them in the meantime, make sure that their care is coordinated correctly and that the changes that happened in the hospital are continued and maintained appropriately. I work under a collaborative practice agreement where I'm managing blood pressure, blood sugar, heart failure, asthma, and COPD, and anti-coag. So we have patients referred to the pharmacy team for management of those conditions. It's very busy, it's excellent, and it's really exciting to have learners, either students or residents on rotation. It really feels like a team. We're really working together. We get along really well, and just to make sure that we're serving the patient the best that we can.
So my name is Faride Abbasi. I'm a nurse practitioner at Inova Transitional Services. We have a variety of patients with different chronic and acute disease that have been discharged from the hospital. We are so happy to be working with Dr. Zengraff and her students. It's really a blessing. We have a variety of patients to refer to Dr. Zengraff, patients that they have uncontrolled diabetes, they have congestive heart failure with hypertension. So a lot of these patients, they're complex patients that their medications, they need to be adjusted. And dosing, of their medications, if there are any contraindication for prescribing any medication or interactions of different medications. So we always, we have actually a question to ask from Dr. Zengraff. It's really great to have Dr. Zengraff and her students here because for managing these complex patients that we have every day.
My name's Sai Cornelio. I'm a faculty member from Shenandoah University, and I'm also the clinical pharmacist supporting services here at Inova Cardiology, here at the Inova Center for Personalized Health. So Inova Cardiology is a large clinic that contains 22 cardiologists and 4 nurse practitioners and an ever-growing practice. And we support patients who are in the Northern Virginia and surrounding areas. We started providing services here around August of 2019, so this is a new facility. As you can see, it's very big. It pretty much is a compilation of 3 separate offices. And we provide services for coronary artery disease, atrial fibrillation. We do diagnostic testing in this facility, as well as anticoagulation support services, among other things. So here in this facility, you would be able to experience a multitude of cardiovascular disease states on rotation with me. And you would also be able to work with a variety of healthcare providers and be a part of a very large, very integrated healthcare team. All right, so first up on our tour is the PT-INR room. Inova has recently approved anticoagulation services to be run by pharmacists and led by pharmacists. And this is where we are planning to deliver those services to our patients. We do point-of-care INR testing here using CoaguCheck machines, but we also do provide services currently to a host of remote patients who do self-testing at home or go to lab for monitoring. And so all of the appointments would be run out of this office. As mentioned earlier, Inova provides various cardiac diagnostic services, one of which is treadmill testing. So in this specific facility and office space, we do have nurses who do exercise stress testing for patients. So here we have one of our nursing stations. This is Neighborhood 1. This is where you'll find our nursing staff and medical staff and very lovely healthcare team working hard to take care of our patients, answer questions, and also help our physicians. So this is a lovely, again, lovely, very integrated healthcare team that you'll be able to interact with during your rotation. So next we have one of our exam rooms. We have a multitude of exam rooms here in clinic to support our patients, where sometimes us as pharmacists would be consulted to see patients if need be by any of the nursing staff or the physicians on day-to-day visits. So next we have our workstation. So here we have my workstation and where you would as a resident be sitting. But in this workstation and workspace as well, we have 2 of our nurse practitioners here in this office space, as well as fellows who do come once a week in clinic. So you'll be able to work with, again, many different healthcare providers. Okay. We have another nursing station. In total, we have 3 nursing stations. This is Neighborhood 3, which has nursing staff and medical staff that support the cardiologists that are officed on this side of the office. including our cardiologists who are a part of our valve clinic, which is in a separate office within Inova Cardiology in the health system, as well as the structural heart disease, in which we are planning to ramp up services and get more advanced practicing practitioners for. So as you can see, this is, again, a very large clinic space filled with more exam rooms for our patients, as well as administrative staff, our nursing lead. Down at the end of this hallway actually is our research program, in which Inova Cardiology is actually involved with a multitude of landmark trials that are up and coming, which is just amazing and speaks to the breadth of what we do here at Inova Cardiology. And finally, also at the end of this hallway is another nursing station that supports the cardiologists that are on this end of the office as well. It is really just amazing to be able to work with a multitude of different providers who are also very supportive and very pharmacy friendly.